Hello, I'm Dr. Helen PENSANTI, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be tackling something that millions suffer from in silence: tinnitus, or tinnitus, you may have heard it pronounced. That's a ringing, buzzing, or hissing in the ear that just won't go away. It can rob people of sleep, peace of mind, and quality of life. To help us understand this condition better, I've invited and I'm joined by a true leader in integrative and regenerative medicine, Dr. Bryn Henderson, a physician whose work combines cutting-edge treatments with a whole body approach. Here today, he will share his insights, innovations, and hope for those living with tinnitus. Dr. Henderson, it is a pleasure to have you on Doctor. Let's start with, what is tinnitus or tinnitus?
Tinnitus is when a person hears a sound like ringing, buzzing, or humming that is not actually coming from the environment. It's only a sound that they can hear. For some, it's a soft background noise. For others, it's loud, it's nonstop, and it's not a disease in itself, but rather a symptom of something that's going on in the auditory system, which includes the ear, the hearing nerve, or even the brain. The ear anatomy has a canal, a cochlea, an auditory nerve, and a brain connection. And possibly the causes like infection, injury, and earwax blockage can be revealed with a simple physical exam.
In my practice, I have enough of patients with ringing in their ears. It's not that common, but what is the actual percentage around the globe?
Good question. It's actually very common. Globally, 10 to 15% of people experience tinnitus at some point in their life. In the United States alone, over 50 million people are affected. For some, it's just an annoyance. But for others, it's chronic, life-disrupting, interferes with their sleep, focus, and emotional health. It's a big deal.
Yeah, I would hate to have a buzzing sound in my ear all the time. You wouldn't be able to think clearly. Well, let's have some causes that we can present to our audience.
The most common is damage to the tiny hairs in the inner ear, often from loud noises like concerts, headphones. I've seen it a lot in the military where people with howitzers are shooting off artillery or something, or factory workers is another good reason. Other causes include ear infections, age-related hearing loss, head or neck injuries, and even some medicines. In some cases, there's no clear trigger, but we know the treatment can help.
Okay, so I'm interested in what medications you have come across that maybe damage the little tiny hairs inside our ear. I know you spend at least 4 or 5 hours a day researching.
The most common causes are antibiotics.
Really?
Yeah.
Uh-oh.
All the doxys and the gentamicin.
Uh-oh.
Most of the time, if it damages a kidney, it can impact the ear.
That is fascinating.
Yeah, so both develop at the 12th embryological week.
I always heard that the ear and your shape of your ear is the shape of your kidney. So, okay, so this is really getting interesting now. All right, so you've mentioned those, and we've talked about on other shows genetics, because of course DNA is so popular now, and everybody knows the word DNA, and probably half the country has had their DNA done. And probably a tenth of those that had their DNA done had the health genetic test done. So what is the link to genetics or development at the embryological stage?
Well, there's a predisposition. Sometimes it's overlooked, meaning tinnitus runs in the family, even in the womb. That's a big deal. Problems like infections, poor nutrition, or exposure to harmful substances can affect how the baby's hearing develops. These are early factors that can set the stage for problems, including tinnitus later in life.
Okay, so when someone walks into your clinic, of innovative medicine and they say, Doc, I've got ringing in my ears, help me, help me. And they're usually pretty desperate.
And frustrated.
Hmm.
And we do start by listening to their history. And when we examine their ears, we do 2 or 3 things, one of which is we listen to it with a stethoscope to see if we can hear the noise.
How do you do that? What? Wait a minute.
Yeah, we have digital stethoscopes, so we can just put on the ear, just like we would the heart, and we can listen. And you want to know, is it a high pitch? Is it a low pitch? Is it constant? Is it intermittent? But then we go after that history. That's when we start into that part, the examination. And that also has a tympanometer, if necessary, and an audiometer all the time. A tympanometer tells us how the movement of the tympanic membrane, is it normal or not? If there's fluid behind it, usually it's infection. It's done in pediatrics all the time. And the audiometer tells us if you can hear low or high frequencies.
Okay, so a person goes in, they get into that horrible and have an MRI of their head, which I've had one before. And the worst thing for me is the clanging noise of the metal. But let's skip to the chase. What does the MRI show in tinnitus?
What you're looking for is if there's some tumor or growth.
Oh.
And that's the key. An MRI shows you anatomy. So you want to know if the anatomy is normal. The 8th cranial nerve, which is the one that carries the sound, could be causing the tinnitus. And the next thing you have to get pretty quick is the impact in terms of not only daily activities, but what's cooking while they're sleeping.
All right. Well, let's shift gears now. You were recently talking to me about a case you had, and I thought it was fascinating, and I'd like our audience to hear it too.
Oh, I remember him. This was a 40-year-old gentleman who came in with 5 years of nonstop, high-pitched ringing in both ears. It started while he was working in a factory. He already tried sound therapy and other standard treatments, but nothing's really helped. His sleep was poor. His focus was gone. It had absolutely destroyed his ability to concentrate. And he was feeling very anxious, and now he was depressed.
So, all right, the guy comes in, he says, I have anxiety, I'm depressed, doctor, help me. And oh, by the way, I have ringing in my ear. Or do they come in and say, Doc, I've got ringing in my ear, and you look at him and you say to yourself, this guy's really anxious and depressed?
Well,
or both?
Both, I think, is fair. You can usually recognize it when it's impacted. Now, remember, he's had this for years.
Yeah.
And he's frustrated to beat the band. And what we're striving to do is identify, is it high pitch, is it low pitch, is it constant, is it intermittent, is it caused by a loud noise, or already ruled out a tumor because his MRI was negative. So we designed a comprehensive plan tailored just for him. First, we used what they call platelet-rich plasma, some PRP, near the cochlea to promote healing.
Wait a minute.
Yeah.
You inject into where
right around the ear, in fact, right here in the base. And so you have 4 things that PRP does. It has growth factors in it.
Yeah.
It has healing factors in it.
Yeah.
Okay. And it also has the ability to decrease pain and increase blood vessels.
But wait a minute, not all doctors are trained like you are. You're injecting something into somebody's head under their neck.
Yeah, well, there's no question.
A bad place.
There's no question. Before you inject anything, you better know where you're going. So we review, even I've been doing this a long time, and I review the anatomy before I stick a needle in somebody's ear.
Yeah.
Okay. But then the point is that besides the PRP, usually inside of it is a peptide like BPC 157 or thymosin beta 4 that supports the repair to the nerve. It also reduces that inflammation. That's a big deal.
All right. So I'm going to talk to the audience because you need to do something right now. If you're driving, you can't do it. But if you're somewhere sitting at home, get out a pen and paper and write this down. B as in boy, P as in Peter, C as in cat, dash 157, and write thymosin, THYMOSIN, beta dash 4. Why do I want you to write these down? Because these two things are going to be as famous as salt and pepper in your lifetime. And you might as well learn these words right now, because every single doctor from today on is going to be spewing it out of their mouths, because it's going to be common to the standard of care.
I think that's good advice. And I might add that we also introduced to this particular man the bioneural feedback. That trains the brain to dial down the noise signals. On top of that, it helps make his sleep better because of the delta.
Okay, neurofeedback. Let's tell the audience, people have heard it, but let's say they come into your office. What exactly are you doing to them?
Oh, the first thing we do is we map the 5 brain waves. There's 5 noises that go through there in waves.
Good noises, of course.
Yes, and I agree with that. And like any wave, it has 2 things. It has amplitude, how high the waves are, and frequency, how fast are the waves. And so that helps us identify the signals and their response. It's like building a muscle in an arm. You can do curls and do that. Well, with neurobiofeedback, helps you train your brain waves.
Wow. You can train your brain like you would train a muscle in your arm?
Absolutely. And it's very successful. And it usually only takes a few weeks to get it done.
Interesting.
We also had prescribed some magnesium supplements for him.
Well, wait a minute. Why just magnesium? There's 94 minerals and trace minerals on that we know of. Why choose magnesium?
Well, magnesium specifically plays a role in synaptic plasticity. That means the nerve connecting or talking to the next nerve, synaptic plasticity.
Okay, so wait a minute. Why don't they give magnesium for people who are losing their memory? They're all talking about Alzheimer's, that you lose your synaptic plasticity. Why isn't that part of the standard of care for memory loss?
It is often given for other neurodegenerative disorders, and that being one of them, and restless leg syndrome is another one.
Okay.
It provides a neuroprotective support inside the brain.
Wow. Fascinating. All right. So what happened to our 40-year-old male that was losing sleep and had anxiety and depression and tinnitus? What happened to that guy?
It was very encouraging, because after about 6 months, he reported a 60% reduction in the intensity of his tinnitus, and he was sleeping much better. He was working better, and he felt much less anxiety. He even said, this first time I felt like myself in years.
Well, that's the kind of outcome we'd like to hear. And if any of you live in California or Orange County, LA County, San Diego County, Imperial County, Kern County, and you can drive to Dr. Henderson's office and you're suffering and no one has helped you, you've gone to lots of doctors and no one did anything like this, you can go right to his office at 615 East Chapman Avenue in Orange, California, and get this kind of treatment.
Well, thank you. And we'd like to have them, and we respect their need to have something done as quickly as possible.
All right, so now let's go on to cutting edge treatment for tinnitus.
But they're actually embarking upon some cell therapy, regenerative cells of many types, peptides, exosome, all kinds of cells that help neuromodulation.
So just to wrap things up with today's show, could you say that you could have an 80% help rate with tinnitus using all the tools that you have in your toolbox?
Absolutely. Please don't give up. Tinnitus is very real and it's very chronic, but it can be managed and we can help you.
Well, I thank you for being with us today. We are now doing mnemonics at the end of every show. And the word today is silence. So what does the S stand for, Doctor?
S stands for stress. That's a big one.
All right. And what does the I stand for?
To identify the triggers. Keep a journal. Track when the ringing happens.
L.
Limits loud sound exposures.
E.
Evaluating your hearing loss. Get it professionally evaluated.
N.
And is for the nutrition and supplements we just discussed.
C.
C is for cognition, and cognitive and regenerative therapies are very successful, as well as the PRP and peptides.
And the final E
is establish a calming routine, sleep regularly, quiet time, limit the screen times.
And I would say to all the mothers and fathers out there, you better warn your children if they're going to have earphones with music blasting. They're going to wake up one day when they're 50 years old or 40 years old and go through what this man went through, and you can cut to the chase and give them this information. Thank you, Dr. Henderson, for sharing your expertise and giving our listeners a new sense of hope. And thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.